Teresa will go ahead and be helping out explaining today, so let's go ahead and jump right in.
First, you're going to need your PPE, your gloves, jackets, masks, and goggles or glasses. On our tray here, we have our dental dam punch, which makes the little holes in the dental dam. We have our dental dam forceps, which holds our clamps. We have our dental dam clamps, our anterior clamp, our premolar clamp, and our molar clamp. We have our dental dam here. Underneath it, I have one to show what a stamp looks like. We don't have a stamp here, we just kind of estimate, but this is a good way to show you how. And the dental dam frame, which holds the dam in place. So over here, we have the Typodont. We're going to place it on number 18. So what we're going to do first is select the molar clamp. This is the clamp we're going to need. The floss tied to it is used for a ligature. If the clamp was to accidentally come off and they were to swallow it, we can retrieve it with this ligature. Just going to set that there. For our dam, I'm going to take our little hole punch. This is sharp, so be careful. It's set on our highest setting. Our rubber dams are used for isolation, for the preps, for dental preparations for the doctor, for root canals to keep the tooth dry so nothing can get inside of it. So that's why we use these in the dental field. I'm going to come in about 2 inches and make 2 small, tiny little holes side by side. If you try to hear it click. There we go. 2 small little holes right there side by side. I'm going to take our dental dam forceps, and these 2 little prongs are going to go in these 2 circles closest to the back of the clamp. This is called a dental dam clamp or a bow sometimes. The back part of it that goes up always goes towards the distal of the tooth. Now I'm going to squeeze this, and this comes down. I'm going to turn it so this part goes towards the distal of the tooth. So now I'm going to place this on the tooth. And I'm going to wiggle this down, make sure it's all the way down on the tooth. I'll wiggle this down to the front, and then I'm going to make sure it's right there, wiggle this out. Make sure it's nice and tight on the tooth. Then I'm going to take my dam and my little hole and make sure I don't try to pull too hard. I'm going to go from this side all the way around to this side. Let's see if I can turn this way a little bit. So we're going to go this way gently. Gently open it up. Very slowly. I don't want to rip my little dam. There we go. I have a little pair of cotton pliers. I'm going to pull this down and make sure that's over this tooth because we're only isolating this one. Make sure everything's covered. See how that's nice and covered? Then we're going to take our frame. With our frame, this part that goes up, this part's always going to go towards the back of the mouth because if we put this back there, they wouldn't be able to work right. So this is going to be towards the front and it goes up like the frame of a house. So this goes here. I'm going to hook back here, kind of all around, make it kind of tight so the patient has nice isolation from anything that would go down their throat. There's our dam. And to take this off, we just take our forceps, put our little prongs in the 2 little holes in the front, and squeeze, and the whole thing comes off in one piece. Very easy removal. And there's our rubber dam.